Would you all stand up? Please stand up. Thank you. We absolutely appreciate you. Look, friends, we find Hennepin County Medical Center, our Tier 1 medical center, our hospital that everybody in the state and beyond relies on in the most serious and important cases, is finding itself in a kind of a perfect storm of financial challenge because of the situation, which is not due to anybody's mistakes or mismanagement, but really because of circumstances. They have found themselves in a situation where they really need to turn to the community that they serve, and that is us. The Hennepin County Medical Center staff and leadership has been talking with the legislature. The Hennepin County Board has been talking to the legislature, and I can assure you, and having spoke to the folks over in St. Paul just a few minutes ago, that they're not far away. I don't want to raise hopes beyond. I want to keep it realistic, but they're not far away. They're working hard. They're at the table. I think I can safely say to you that something positive will be done. The terms of that are being negotiated as we speak. And Jeff Lundy, as the county board lead on the hospital, thank you for the work you've been doing. Let's hear it for the county board. They have been working hard. But the challenges are serious. And let me just give you a little bit of context. I do a lot of community meetings. And one day I was in Wilmer, Minnesota, which is a few-hour drive from here. And any Wilmerites with us tonight? Well, let me tell you, that night when I was in Wilmer, I mentioned that we were working through Lois Quam and others to do what we could at the Attorney General's office to bring folks together to try to come up with a sustainable solution for our hospital. And this woman stood up and said, I am a nurse, and I was a nurse, and I worked on the helicopter that helps bring people from rural communities to Hennepin County Medical Center for care. And so, Keith, when you say that Hennepin County Medical Center is a statewide asset, I'm here to tell you that's absolutely the truth. And we all need to succeed here, and getting to the right answer is all of our business. So I just tell you that because that really is true. I want to mention that even though Hennepin County Medical Center leadership has been working hard, county board leadership's working hard, the legislature's working hard, I'm very proud that some of the healthcare leaders in our community have shown real interest in solving this problem. You're going to hear from some of them tonight, but I just want to make sure that you know that this is not a situation where the business community cares, but then somebody else doesn't, or somebody else cares, but then somebody else doesn't. No, everybody kind of cares about this, and you're going to hear from people leading some of the most important healthcare institutions in our state and really in our country. And I want to thank you all for being here tonight. And so you're going to hear from them. I won't step on what they're going to say, because I want you to hear straight from them. But I want you to know that this is something that whether you are a nurse at Hennepin County Medical Center, whether you lead another hospital who depends and works with Hennepin County Hospital, no matter who you may be, this is something that we have a shared interest in protecting. Now, let me just tell you that as Attorney General, we do have important role to play when it comes to health care in our state. As your Attorney General, there is a transaction law that was written so that we could review mergers and transactions between hospital systems with an eye toward the public interest. We also supervise charities. And so because of these roles that we have, I have, along with my staff, worked to try to look out for our whole healthcare ecosystem. But I will tell you, at the end of the day, this is really in the hands of a number of people. One of them I mentioned, the legislature. I'm going to ask you to encourage them to keep working hard. Now, look, I know that in the world we live in, a lot of times politicians hear from people when they're mad about something. But it's okay to call them and tell them we're glad that you're working on this and we want to encourage you to get to a real solution. That's all right too. Would anybody be willing to do something like that? Call your legislator and say, we really need y'all to get something good. And I will say this, you can do something and then you can do something really good. And I'm pushing for the really good because, you know, look, the people who work at Hennepin County Medical Center, they're really good. They're nationally recognized. And other systems around the country and around the state are like, hey, you want to work here? And we can't afford for these top-notch professionals to get bled out and poached because there's things in the news that signal the potential for vulnerability. You follow what I'm saying? So I'm asking you to tell the legislature, do something good, do something meaningful, do something that is going to make that brand new nurse or that person who's been looking at retirement or somebody in between who's thinking about their future, that they really do need to stay at Hennepin County Medical Center because the state, through its legislature, is going to make a real firm commitment. Tell them that. Would you tell them that? Okay, good. And so with that, I'm going to grab a seat. If you see me looking at my phone, I'm not checking my emails or my text messages. I'm using it to take notes, okay? Because I'm going to run out of this paper. But Lois is going to guide us through the comments. Please listen to everybody. You may hear somebody you don't agree with. That's okay. That's why we have community meetings. You may hear somebody you definitely agree with. That's okay too. But we're here as a community to solve our problems and to get through this crisis. But then ask ourselves after we get through this crisis, and we are going to get through it, what next? How are we going to build a strong, stable, world-class, innovative healthcare system where we're training medical professionals, doctors, nurses, and others? How are we going to build something in the future that's really strong and really solid and is the envy of the whole country? That's where we really need to aim. We need to aim high. Let's not just solve this problem. Let's solve the problem of healthcare in America. Minnesota's always been a leader. Let's do that. So with that, I am going to turn the microphone over to your, Master of Ceremonies, your MC, who's going to do a great job. My dear friend Lois Quam, who has been helping me work through these health care issues throughout the state. And I just really want to thank all of my staff, and particularly you, Lois. Take it away.
Thank you, Mr. Attorney General. Commissioner Lundy, could I ask you to make a few remarks? Commissioner Lundy serves on the Hennepin County Commission and is the chair of the board for the Hennepin County Healthcare.
Is this on? Everybody here? So first, I want to thank the congregation for hosting us tonight. When you marry a Catholic woman, you spend a lot less time in your Lutheran church. So I knew the moment I walked in where I was. My son goes one block next door while he's at the U of M. So thank you to the congregation for having this conversation. I want to thank Attorney General Ellison. Your support has been unwavering. Your commitment and your desire to make sure the hospital isn't just about, is it here next year? It's doing work and continue to do work. We believe HCMC is the safety net, not just for patients, but for the whole state. So other hospitals use us as their safety net. And we know the state of healthcare, there's a dozen hospitals that might close this year. There's a dozen more that might close next year. And if we are not able to succeed, that you take us off the table, things will get more complicated. I want to say to everyone here that we're not here to settle, we're not here to hope, we're not here to beg, we're not here for anything. We are here that the hospital gets funding so that it continues to do what it's been doing. At 3 in the morning, no matter where you are in the state or in our neighboring states, you might find yourself in the need of the kind of care that you can only get at HCMC. And if HCMC is not open, it serves no one. And so we are here to work with anybody and everybody, legislator, Attorney General, the governor, to figure out how can healthcare be better, but we have to get to that next stage, and that's where our desire for the legislature to take action. We've had good conversations. We've asked for lots of things. We've presented a budget, but make no doubt about it, we have asked for a 1 cent sales tax because it gets us ready for something that has not hit us yet, which is H.R. 1. That has not affected us, but it will start next year. And so we need to get ready for that. It's like getting a ship ready for a storm. We're going to be ready to fight. I want to give credit to county staff, HCMC staff. We're here to kind of fight for what matters and fight for the patients, whether they've been with us, they are with us, or hopefully if they show up on their worst day of their life, they end up leaving on the best day of their life. So I want to thank you again, Attorney General Ellison. Thank you.
Thank you, Commissioner Lundy. Reverend Babington Johnson, may I ask you to make some remarks?
Good afternoon. My name is Alfred Babington Johnson. I am the convener of His Works United, the largest ecumenical coming together of African-American churches in the state of Minnesota. Mr. Attorney General, in the not distant past, when warfare was more conventional, the air of a battlefield might be shattered with medic, medic! And as alarming as that call might be, I'm sure that one of the comforting realities was that some dedicated medical personnel would hear that cry for help, put their personal safety on the back burner, and attend to the need. The potential tragedy before us is that members of our community who are in the greatest need of medical attention will now have their cries for help go unanswered. Despite the tremendous challenges that continue to be imposed on the hospital of last resort, for most of the economically challenged of our community, HCMC has served well. Our entire community is aware that Hennepin County Medical Center, despite increasingly difficult financial challenges, has been recognized as a premier trauma center for our region. I understand that up to 70% of our medical professionals have received some of their training ministering at HCMC. Our call today is not medic, but legislators, business leaders, county commissioners, fellow citizens, let's rally to preserve and strengthen the financial underpinnings of this vital community asset.
Thank you, Reverend Babington Johnson. Bill George, could we ask you to make some remarks?
Thank you, Mr. Attorney General. My name is Bill George. I've been involved in healthcare since I joined the Board of Abbott Northwestern in 1983, and have been dedicated and have studied this system, later chaired the Board of Abbott, and was served as chair and CEO of Medtronic for 12 years, and later served on the board of Mayo and was chair of Allina. So I had a chance to see our healthcare firsthand in this community. And I want to thank you for taking this essential problem on. You've been known to all of us in the community as when there's a really tough problem in Minnesota, the Attorney General Ellison will take it on. You did that with you did that after the murder of George Floyd, the tragic murder of George Floyd, and you've done that now with the university in Fairview and tried to settle that because you know what makes Minnesota great. We have one of the greatest healthcare systems in the United States. We're always ranked in the top 3. Those of us raised our families here know how important it is. And I can say that Hennepin Health is an essential part of that. We can't survive without Hennepin Health to have great health care and attract people from all over the nation, all over the world without it. And so it's just essential we do that. And I want to say, here we have the #1 trauma center in the state, but one of the top ones in the nation. We have the bariatric center that's essential. It provides great emergency care. In our neighborhood, and we hear helicopters coming, we know they're coming from all over the state. This is not just a metropolitan facility, but a statewide facility, because it's the only place you can go to get great care when you have an emergency. Just last Sunday, I visited a friend who 93 years old, who had her second stroke. Ambulance got there within 4 minutes, and she was sent to immediately to Hennepin Health, and she's being restored to full life and health, only because of the skill of the doctors. So this is a place. It also the major training center for the university, and I have a son and daughter, or both my daughter went to school at the university. She was trained at here at Hennepin Health, because if you want to be a great doctor, you got to see the toughest care, and that's what you see, the toughest cases. So we know that this is critical. Now I want to say they have an impossible patient mix, okay? Because they take care of people who in Medicare and Medicaid, as well as uncompensated care. And it's true, our federal government has chosen to under-reimburse for this, and the only way the other hospitals get by is because we have higher value patients. And so I just want to say we can't get along without it, and I hope that you will sincerely convince the legislature that we have to solve this problem because it will make Minnesota have a great healthcare system for decades to come. Thank you.
Thank you, Bill. Fairview, Lisa Shannon, the CEO of Allina.
Good evening. My name is Lisa Shannon. I'm CEO of Allina Health, and I am very, very grateful that you have hosted this forum in a critical time for Hennepin Healthcare. I am also grateful that you have hosted this forum to shed a light on the vulnerable ecosystem that surrounds healthcare for all of our communities. While we are here tonight in support of Hennepin Healthcare, we must all recognize, and I would be remiss if I did not recognize, that the broader sustainability of healthcare across our entire community, it really impacts all of us. Yes, we must have a solution for Hennepin, and we must recognize the real risk that exists for all of healthcare around our community, the crises that we all deeply face. It is our collective responsibility to strengthen healthcare within each of our organizations, and certainly for our friends and neighbors at Hennepin Healthcare. If we do not collectively think deeper and more broadly, we are going to face another crisis that our community cannot afford in healthcare. Minnesota's nonprofit healthcare ecosystem, it does work together. It is interwoven and unfortunately fragile. So we must find a way to serve not only the increasing need, the growth of our community, but also the increasingly complex needs of our community. Our region needs every one of us. Having a failure of this size and consequence would be significant. It would impact all of us. And I am deeply proud of the collaboration that occurs across healthcare. We see it in big instances such as COVID, and frankly, we see it in small ways for training and supporting one another. This is a community, we show up for each other. We support each other, we're good neighbors with each other, and that's certainly true with Abbott Northwestern and Allina Health as a close neighbor to Hennepin Healthcare. This is a very vital time for our community, and I'll just wrap up by saying, as a leader in healthcare, I recognize how important Hennepin Health is to all of us. I also recognize how important we all are to each other, working together to strengthen how we can have a vibrant and sustainable healthcare for all of Minnesotans. Thank you.
Can I ask you a question? So, look, we're gonna save Hennepin County Medical Center, but let me just ask you this. Say, for example, we didn't have that great asset. They do about 1,000 emergency room visits a year. 100,000, excuse me. Yeah, I left off a lot. 100,000, good catch. Could Allina just pick that up and absorb that with no problem? Or what would that mean for somebody like you guys at Allina?
There's not a single ER in this community that could support all of the ER needs of our community. We are all struggling for a sustainable future within our emergency departments. No one of us could.
So they're a key partner.
Key partner. Thank
you.
you. Thank you.
Lisa
Thank
Shannon,
you, Lisa
everybody.
Shannon. James Hereford from Fairview, please.
Oh, that may not work. Just do this. Good evening. My name is James Hereford, and I serve as the President and CEO of Fairview Health Services. Thank you to the Attorney General and the community leaders who have organized this important discussion. I'm here tonight on behalf of Fairview to express our support for Hennepin Healthcare and for the critical role HCMC plays in our region. HCMC is not simply another hospital. It is an essential public institution and a foundational part of our healthcare ecosystem, not just for the Twin Cities, but for the entire state. Every day, HCMC serves patients and families facing some of the greatest medical, behavioral health, social, and economic challenges in our community. That work is extraordinarily important, and it is also extraordinarily difficult. The financial pressures associated with caring for highly complex and underserved populations are real, and they're growing, not just here in Minnesota, but across the country. Those realities require all of us in healthcare, government, and the community to think differently about how we sustain these institutions for the long term. At Fairview, we understand many of these challenges firsthand. We also serve vulnerable populations in both urban and rural communities. And over the last several years, we've worked through a significant transformation of our own organization. During that time, Fairview achieved approximately a $600 million financial turnaround while also improving quality and safety and strengthening the patient experience and improved employee engagement to top quartile levels of performance. That experience reinforced an important belief for us. Mission and operational performance are not competing priorities. They are synergistic. They must advance together if organizations are going to remain strong enough to serve their communities over time. Our commitment to community health remains central to our mission. We're proud that Fairview was recognized in 2025 with the Foster G. McGaugh Award, a national award, for work addressing health equity and broader social factors that influence health outcomes. We know HCMC shares these critical values and commitments. Tonight, I simply want to say that Fairview believes HCMC matters. It matters deeply in this community, and we stand ready to be constructive partners in any conversations about how to help ensure long-term strength and sustainability. The challenges facing healthcare today are larger than any one organization, and the solutions require significant levels of collaboration. We have a shared purpose, and we continue to focus on serving people who depend on all of us, but we must come together to solve this healthcare crisis. Thank you.
Thank you.
Thank you very much, James. We're going to take two more speakers, and then we're going to open it up to the floor. I'd like to call next on Megan Remark, who's the Chief Operating Officer at Health Partners, and then I'll call on Dr. John Cumming from Hennepin County Medical Center.
Thank you. My name is Megan Remark, and I'm the Chief Operating Officer at Health Partners, and I had the privilege of also serving as the President and CEO of Regions Hospital in St. Paul Level 1 Trauma Center for over 10 years. HCMC, Hennepin Health's future, matters to all Minnesotans. We appreciate Attorney General Ellison's convening this forum today because Hennepin Health's future is not only a Hennepin County issue, as we'll continue to hear over and over tonight, it is a Minnesota healthcare infrastructure issue. Health Partners understands Hennepin Health's role because we have a similar public hospital legacy at Regions Hospital. As a former public hospital with continuing safety net role, Regions Hospital may be the closest institutional peer to Hennepin Health in Minnesota in terms of our public hospital legacy, our safety net mission, our trauma readiness, and commitment to care regardless of ability to pay. The remaining Level 1 trauma hospitals could not easily pick up Hennepin's volume. Minnesota is fortunate to have multiple strong trauma centers, including Regions, but that does not mean that there is sufficient excess capacity to absorb Hennepin's emergency, trauma, burn, specialty, and safety net volume. The issue is not whether all of us as hospitals are committed to helping. We are. The issue is whether physical capacity, staffing, specialty infrastructure, and financial capacity exist to absorb the loss of Hennepin. We do not. Safety net hospitals may be located in one county, but their role is regional and often statewide. Hennepin's financial crisis reflects a number of variables that have already been mentioned, including the structural challenges of operating essential safety net services when a high share of patients seen are uninsured, underinsured, or covered by government programs that often do not cover the full cost of care. Partnerships are important, and we're here to partner, but they cannot replace a stable financing solution. And partnerships alone cannot fill a structural funding gap for uncompensated care. I'll close by saying that the answer is not to let one pillar of the safety net system fall and ask the remaining hospitals to absorb that impact. The right answer is to stabilize Hennepin Health, strengthen partnerships, and ensure Minnesota has the emergency, trauma, specialty, and safety net capacity its residents need, including helping people get signed up for Medicaid if they qualify, while seeking broader payment reforms that support our healthcare system statewide. Thank you.
Thank you very much.
Thank you very much, Megan Remark. So next, I'd like to ask Dr. John Cumming, who's the CEO of Hennepin Healthcare. We know you're bearing an enormous set of responsibilities now, and we thank you for that. Then we're going to take 6 speakers for the floor, and then we're going to return and have the president of the Minnesota Nurses Union speak. Thank you.
Thank you. Thank you very much. Mr. Attorney General, distinguished guests, and everyone assembled here this evening, thank you, thank you, thank you. We're so appreciative. My name is John Cumming, and I serve as the CEO of Hennepin Healthcare. I'm humbled by the sheer strength of the community support for HCMC that I have witnessed over the course of my very short second rodeo. It speaks really volumes, I would say, to the importance of this critical resource to the community and greater Minnesota. I first stepped foot onto the HCMC campus back in 1991 as a medical student and completed my career with the organization as CEO from 2019 to 2020. But I am a kindred spirit to all of you. I could not stand by and watch when the opportunity arose for me to serve again. I am here with just 4 weeks under my belt, but truly, truly appreciate all of the concern that I have felt and heard over the past 4 weeks, not only with community members, but at the legislature as well. It has been energizing, to say the least. During the last 4 weeks, I've really been focused on 2 key issues: the legislative efforts and working to communicate to the workforce a message of optimism that there is a path forward for us. After spending many hours at the Capitol, I'm starting to see some light. A lot of work remains for our team as we chart the path forward, and I am also thankful and energized by the comments of our fellow healthcare leaders, because I think a path forward for us includes partnerships and how we reimagine healthcare in the state and for our communities. Finally, my heartfelt thanks to Attorney General Lois Quam and staff for organizing this event. I don't need to tell you that the AG talks the talk and walks the walk. He's such an incredible advocate for us. I was at the Capitol just a few hours ago. I was meeting with my team. I turned around and I looked across, and there he was with a group of Minnesota Nursing Association folks, and he was engaging them in a vigorous conversation. I walked over and I said, "Mr. Attorney General, how's it going?" And he said, "Well, I'm just here to make sure that they do what's right." And we are so appreciative of that. Thanks to him, we are hopeful. And thanks to all of you. Thank you very much.
Excuse me, Dr. Cumming, I just want to tell everybody in this room that this doctor leads from the front. He's not way in the back. He's up front. He's there with his fellow colleagues there, and he might be the leader of those colleagues, but he's not sitting in an office somewhere. He's on the floor of that legislature talking to folks. So thank you, Doc.
Thank you, Dr. Cumming. I'd invite members of the community to go to any one of the 3 mics to make your remarks. We'd ask you to keep it to 2 minutes so that as many people as possible can speak. And we'll take 6 speakers at this moment, and then come back and have more speakers. Thank you. Please introduce yourself.
Hi, I'm Heidi Novak, and I am a women's health nurse practitioner that just retired from 33 years of service at North Point Health and Wellness Center that sends over 60 to 70% of all their obstetric patients to Hennepin County. This issue of the hospital closing would not only be a detriment, but it would be a torrential cascading effect of turmoil for all people that receive service there, as well as all of us who live in the state of Minnesota. I want to say that I personally experienced wonderful care when I had a severe bleeding episode that I could have bled out, and Hennepin County is essential to the lifeblood of this state's health care, and I appreciate this forum and your presence here. Thank you.
Thank you, Heidi Novak. Welcome, and please introduce yourself.
Hello, my name is Kelly Mulcahy. I've been a Hennepin Healthcare employee for over 10 years, the past 2 years working as a nurse in the emergency department. I have a couple of direct questions for both our elected officials and then our Hennepin Healthcare officials as well. First, let me preface everything I'm about to say and everything I'm about to ask by just saying that I absolutely love where I work. Hennepin Healthcare cannot close, not just because I love my job, but also because it would yield an irreversible socioeconomic and public health crisis, not just for Minnesota, but for the entire Midwest region and beyond. That being said, I'm a little bit concerned about some of the solutions that were put forward, like the expansion of the regressive ballpark tax. I would like to ask, should this legislation go through, be it through like grants or through an expansion of the ballpark tax, what specific accountability and transparency measures will be in place to ensure that these funds, regardless of where they come from, are going directly towards our patients and are not lining pockets? That's my first question. My second question involves my concerns over the expansion of eminent domain. If anyone's read the bills, they'll see that there's an expansion of the eminent domain to include healthcare facilities and related infrastructure. I'm concerned because that's kind of a vague term. I mean, if you wanted to say, put a Band-Aid in an Amazon warehouse, you could call that healthcare infrastructure if you wanted to say, stretch the term. Anyone that knows any history of eminent domain knows that it does have a long history of being weaponized against both the working class and people of color, like in the seizure and demolition of the Rondo neighborhood to make way for I-94. So my question regarding that is, what specific safeguards will be in place to ensure that this expansion of eminent domain respects the rights of individual citizens and individual communities and is not used as a weapon against our working class?
Thank you very much for posing those questions.
Thanks for your questions. They're both excellent questions. I can tell you that they're at the table negotiating this bill now. And so I've written your questions down, and you can feel confident that I will tell those legislative leaders exactly what you said and exactly how you feel. And I can tell you that they have these things that you mentioned have really been raised by people who are party to the negotiation, and the equitable funding system has been definitely a part of the conversation. But I'm telling you now, if you want to impact the legislative process, now's the time, and you being here is helping to advance that. I can't give you the exact specifics you're asking for because this is a negotiation. I can tell you what I can tell them what you said, and so can you, but I can't tell you where they're going to land. It's all going to be determined pretty soon, by Monday for sure, if not before that.
May I have a couple seconds just to express a follow-up concern?
You know, I'm going to ask whether we have other speakers, and if we have time, we'd be happy to have you speak again later.
Thank you, ma'am.
Thank you very
All right,
much.
thank you.
Yeah, thank you. Please.
Hi, not tall enough. I'm Katie Guthrie, and I'm a family physician in Minnesota. I have been in practice now almost retired, for 46 years. And the first 14 were in 2 rural communities, and HCMC and North were both referral centers from far northern Minnesota and provide services that were not available. I trained at Regions when it was Ramsey, and the training we got in trauma was absolutely critical to functioning in a town of 900 people where you were the head of the ambulance service for 2 small towns and had to stabilize people for survival purposes. That is a key We forget that Hennepin has one of the largest family medicine training programs in the state. We are facing a critical and increasing shortage of family physicians, particularly in rural communities with all the financial insecurities that are happening at hospital levels. My own hospital up north has lost its obstetrical services, and people are driving rather extraordinary distances in some cases to receive service. So HCMC has a dual level function. It does on-the-ground care for the community, and it does multiple high-level specialized care. We send things from United to Hennepin. There's some very specialized lab work that we get only at Hennepin. And several of our grads work at Hennepin. Hennepin is at risk of losing one of the more genius young researchers in community health care because of this current instability. This kind of instability can't wait for another budget year. If you've lost 25% of your cardiologists already in a crack cardiology department, I have patients that prefer to come here for what it's worth. This is a solution that needs to happen now.
Thank you.
At multiple levels.
Thank you very much. Welcome. Please introduce yourself.
Hey, Mitchell.
Hello, friends, neighbors. Thank you. That's a little better, thank you. It's good to see our friends and neighbors. Attorney General Ellison, good to see you tonight. I'm rising up to speak about not about a hospital budget, but I rise to speak about the moral character of our community. I have 25 plus years of experience in healthcare, Minnesota Hospital Association, North Memorial Hospital, Kellogg's Foundation Pediatric Care, the director of Minority Multicultural Health at the Health Department, and also a former board member of the Hennepin County Medical Center. The question before us, to me, is very simple. Who deserves to live? Who deserves care? And who deserves dignity when they're sick, they're wounded, they're suffering, or afraid? And the answer must be everybody. Hennepin Healthcare stands as a sanctuary for the people too often pushed to the margins, the poor, the uninsured, the struggling worker, the elder, the veteran, the person battling addiction, the child in crisis, the neighbor with nowhere else to go. So Hennepin Healthcare does not ask first whether you're wealthy, it asks whether you are hurting. We need Hennepin Healthcare. So when trauma victims show up at night, Hennepin County Medical Center is there. When the mental health crisis overwhelms family, Hennepin County Medical Center is there. When working people cannot afford private care, I'm going to say that again. When working people cannot afford private care, Hennepin County is there. When nobody else will answer the call, Hennepin County is there. So we need Hennepin County Medical Center in place, funded fully, so that they can continue their care. Budgets are moral documents, and a moral document protects the sick, the vulnerable, and the common good. And so today I urge all of us, do not weaken Hennepin County Medical Center. Strengthen it, fund it, defend it, and preserve it.
Thank you so much. Thank you. Welcome, and please introduce yourself.
Hi, my name is Mohammed Reza Chowdhury. I'm a second-year family medicine resident at Hennepin Healthcare. It's my home. I'm an immigrant too, and I take care of people from all backgrounds. The training I receive at Hennepin is by far the best training I could ever think of. Working with people who day in, day out love what they do, care about everyone who comes through our doors, comes through our clinics, from first breath of life to their last, and everything in between. I'm very proud to be part of HCMC, and it makes me really happy to hear all the support we get. I think just building on the last speaker's comment, strength is something that unites the community I work with. So I treat it as my home, and I would love to see that continue, regardless of the noise that may be around the hospital, the different things that are occurring in our state. We send our graduates to the rural communities, they work there, they stay in the Twin Cities, they go to other states. They can work anywhere in the world based on the experience I've had so far, and I have another year left. I can't imagine what it'll prepare me for moving forward. I really want everyone to think about that, because the primary care workforce is going to be struggling to meet the demands of our population. And I think keeping that program strengthened with everyone's support is going to go a long way. As primary care physicians, as family physicians, we treat generations. And we want to see that continue for another at least 10 generations moving forward. Thank you.
Thank you, Mohammed. Thank you. Welcome, and please introduce yourself.
Thank you, Attorney General Keith Ellison. My name is Dr. Ergando. I'm a cardiology fellow doctor. I did my residency at University of Minnesota, and I'm soon to be a cardiologist at Hennepin. And speaking of Hennepin, overall, about 70% of physicians working in Minnesota are locally trained in Minnesota. And out of that, I would say majority of those trainees go through Hennepin County Medical Center to be those doctors. So the effect of closure of Hennepin County is not only on the healthcare itself, also on the physicians and the amount of physicians that go through there getting the right type of training won't be getting that. Speaking from the cardiology, from the cardiac standpoint, from the heart standpoint, when a person gets heart attack, the person goes into something called cardiogenic shock, which is a state where if we're not intervening timely, that person will die. We have about an hour, 30 minutes to intervene and save that person. What happens is if Hennepin closes, then we have longer delay, longer wait times. Those persons could be you and I, our loved ones, and those people will die. I have been part of the cardiology team where we took care of somebody driving to work in the morning, heart attack, almost dead, come to us, walked out alive. We have taken care of some people, come and watch game at the US Bank Stadium, heart attack, almost dead, come to us, walk out alive, most of them. So all I'm trying to say is Hennepin County is not only a hospital healthcare system, it's an infrastructure. So we often talk about healthcare as an expense, but hospitals like HCMC are not expenses, they are infrastructures. Just like trauma center systems, EMS or fire departments. You do not appreciate their full value on ordinary days. You appreciate them when everything else is under pressure. Thank you.
Thank you very much. Thank you.
Thank you, Doctor.
I wanted to invite the president of the Nurses Union to speak. Thank you so much for being here today. We'd love to hear your remarks.
Thank you so much. My name is Chris Rubish. I'm president of the Minnesota Nurses Association. Thank you, Attorney General Ellison, Mr. Quam, for being here. And importantly, thank you everyone else for being here on a beautiful night. Thank you to our nurses, our nurse practitioners, our doctors, our paramedics, all the healthcare workers and community members who are here. So I'd like to start by saying I'm a bedside care nurse. I'm a cardiac nurse in Duluth. I'm about 2.5 hours north of here. And I actually work at a level 1 trauma center. And as has been told by other people here today, I can attest to the fact that HCMC is vital for my patients and my community all the way up in St. Louis County. Because I, at a level 1 trauma center, also have seen patients referred to HCMC. Because they offer treatments, they have special skills and services they're able to provide that my facility cannot. So they really are crucial for everyone in the state of Minnesota. And my patients' care, my patients' outcomes and success depend on HCMC staying open. We have a choice here in Minnesota of what we want our future and our healthcare system to look like. And if HCMC closes, these patients aren't going away. This isn't a problem that we can close our eyes to and just expect to disappear. People need healthcare, and they're going to go somewhere to find it. And if we don't have open doors and facilities ready to receive them, then we will all suffer. Our healthcare will also deteriorate. When your neighbor's house is on fire, you don't quibble over the price of your water hose, right? You help. And so we in Minnesota need to step up, and we need to say that this hospital is critical to my success, to my neighbors' success, and to everyone else's health and well-being here too. And so let's do what we need to do to make sure Minnesotans can get the care they deserve.
Thank you, Chris.
Thank you so much. I wanted to invite Sandy McAllister from AFSCME to speak next, please.
Hi, I'm Sandy McAllister. I am a certified medical assistant at Hennepin Healthcare in one of the busiest primary care clinics. HCMC, I've been there almost 12 years, and we are critical for our patients. We see patients in our clinic, specifically from outside of Hennepin County. They continue to stay with us because of the care they get with us. We are an infrastructure. We don't look at who they are. We want to help them, heal them. We're here to make their life better. Hennepin County closing will be detrimental to our public, our patients. We don't go there for a job. Those of us that have been there, we're there longevity. We have been there to be there for our patients. We have a great camaraderie with our patients. I've had some of the same patients for almost 12 years, and that says a lot. Patients find that comfort. They don't want to go outside. I'm in the process right now. We've had patients asking us, what do I do? What's going to happen? And trying to calm our patients' fears at this time is detrimental. We don't want them to just go anywhere where they're going to say, well, I'm not going to find any care. I'm just not going to go. Then what happens to our population? I've had patients come from Alexandria and stay with us. So it's just not a county hospital or clinic. It is a regional. We've seen people from outside of Minnesota as well. And closing Hennepin is utterly detrimental to all the patients around. Thank you.
Thank you very much, Sandy. I'd invite two speakers from the community. Are there any two speakers from the floor? Thank you.
Buenas tardes. Mi nombre es Dulce, soy promotora de salud de la organización COPAL.
Hello, her name is Dulce. She's the healthcare coordinator for COPAL.
Voy a hablar por mí y por mi comunidad.
She will talk on her behalf and on the behalf of her community.
Hennepin Healthcare ha tenido el cuidado de mi salud por más de 20 años.
Hennepin Healthcare has cared for me and my health for about 20 years.
Me ha salvado la vida muchas veces.
It has saved my life many times.
Y ha salvado miles de vidas de mi comunidad emigrante.
And it has saved thousands of lives from my community.
Es el lugar a donde no le cierra las puertas a nadie.
That place does not close its doors to anybody.
Y por eso no pueden cerrar.
And that is why this hospital cannot close.
Además de ser un santuario de salud, es un santuario para nuestras almas.
In addition to being a sanctuary for our health, it's a sanctuary for our souls.
Mi comunidad necesita ese centro.
My community needs that healthcare center.
Necesitamos luchar para que ese centro de salud permanezca y sea más exitoso.
We need to fight so not only does that healthcare center stay, but it gets better with time.
Gracias.
Thank you.
Thank you very much. Thank you.
Con mucho gusto.
Thank you. Please welcome and please introduce yourself.
Sure. My name is Amity Foster. I am a community member. I have private insurance, and HCMC is my hospital of choice. It has been my hospital of choice for more than 20 years. My former husband was on the medical ICU unit. 6 years ago, he ended up with acute kidney failure, went to Napa Rehab for his treatment. I go there to see my neuro, my OBGYN, my PT, some other doctors. It's a great place. Every time I go there, no matter what floor I sit on the clinic and specialty center, there are people from all races and classes in those rooms. I will be able to find another hospital fairly easily. The continuation of care that HCMC provides for people, that's what we will also lose if it closes. I am glad that this forum is being held. I hope that you continue to hear the stories of patients and people who rely on HCMC for their care and their survival and their ability to thrive. Thank you.
Thank you so much.
Thanks so much.
Marty.
Hi, I'm Marty Lewis Hunstiger, and this is my church. Welcome to my church. But I'm a nurse, and I've been a proud M&A member since 1972. I didn't wear red today, but I should have. I'm here to talk about a different demographic and a different service that HCMC has provided for my family, and that is end-of-life care. My father was Charles Lewis. He was a family physician in Henning, Minnesota, and he actually delivered one of Lois Quam's siblings.
He delivered my older brother.
Yeah. But he had a stroke at the age of 60. 35 years later, he and my mother were living at Augustana Senior Care, just a block from HCMC. So their health care was there. They had Medicare up the wazoo. My father also had a VA disability determination. So as the previous speaker, they had the kind of health care coverage that perhaps helps offset the uncompensated care and the undervalued care. But the care that they received, not only in the hospital, but in the clinics, those are in danger too. Those clinics are in jeopardy as well. The care they received in the last 4 years of their life was wonderful. A couple different times my dad wound up in the ER at Hennepin, and he was almost totally aphasic, so, which means he only had a few words. He was still hitting on all cylinders, but he couldn't speak. So when I would get there to the ER, they were always very glad to see me because I could communicate with him better. But they hadn't just stuck him in a room somewhere waiting for me. They had given him the best possible care during those moments till I could come. Because of the care they received, both of them were able to transition to the next, wherever they are at the age of 95, in their own bedrooms because of the care they got at HCMC. My cousin, Charlene Levy, was a social worker with Hennepin County Child Protection for decades. HCMC was her hospital as well, too, not because she didn't have other options, but because she chose that. So those of you, if you think no one sees you, I see you, and I will never forget you.
Thank you, Marty.
So much, Marty. Dan, nice to see you.
My name is Dan Humes, and I am grateful for Hennepin County. I still have a sister-in-law. In 2009, my sister-in-law was working out at Lifetime Fitness downtown and was observed early in the morning, was observed, I think, by an HCMC doc. doing a workout also, face down in the water. She was miraculously taken over to HCMC, was jolted 6 times to bring her back to life, spent about a month in an induced coma, and they fixed her. They fixed her, and I still have her. Thank you.
Thank you. Thank you, Dan. Please.
Good evening. Thank you to the Attorney General for hosting this. My name is Lex Martin. I'm a registered nurse at HCMC. I'm also a patient of HCMC's and a resident of the city of Minneapolis. And recently I read a really interesting statistic that in 2025, 1 in 50 Minnesotans got care at HCMC. 1 in 50. And even for people who might not think that HCMC is their hospital, all it takes is 1 car accident, 1 carbon monoxide leak, 1 cancer diagnosis in between jobs when you've been on private insurance your whole life, and HCMC is your hospital, and it might be your only hospital, and we will give you the best care possible. That said, one of the most viable options right now within the legislature is a Hennepin County sales tax increase. And one of our previous speakers recently stated very wisely that a budget is a moral document. And while if that is the viable option to keep this statewide asset moving forward, so be it. But as I understand it at this time, some of those dollars might also be allocated towards the ballpark still. And a budget is a moral document. The MLB, I believe, is a $70 billion organization that while it provides America's pastime, it does not provide a public good. It does not save lives. It does not keep people from falling through the cracks, and it's not a hospital. It's not a public safety net. It's a game. And I implore our legislators, if you are going to implement a regressive Hennepin County sales tax, asking Hennepin County residents to subsidize impeccable care for the rest of the state, please don't squander those dollars on a ballpark.
Thank you very much. We'll come to you next. But I just wanted to take a moment to thank Jan Malcolm, who's here, former health commissioner, and the governor's designee on Hennepin. Thanks for coming, Jan. Over to you.
I'm Marie Sorensen. I retired 2 years ago. I was at Hennepin County Medical Center for almost 41 years. I went through the AIDS, I went through COVID, I went through everything there. Hennepin has saved so many people. One of the things that people aren't talking about is that when dignitaries and celebrities and government people at the Capitol are in Minneapolis, Hennepin County is their backup hospital. If Trump came to town and he got shot and he was in Minneapolis, he would come to our hospital. When Reagan was president, it was a backup hospital. He sent flowers, all the flowers from his convention to the hospital. We're not supposed to talk about these people because of HIPAA. We can't name these people, but I know people who have come to our hospital who are not the poor, and they are not the underserved. And there are people who get in car wrecks and house fires and those big mansions out in Minnetonka. You can get carbon monoxide poisoning out there just as well as anywhere else. This is a survival hospital for the city, the state, and the region. We get patients from all over. I have been part of this for so long. I'm old enough to know that Hennepin did not stand on its own. It shared with a public hospital, which failed. And we used to share all our supplies and resources and everything. It's not always been on its own. So I wonder if that can happen again. It's been our family hospital. I go to Whittier. My husband has had almost all his cardiac care. He was in a stress test at one point, and the cardiac crash cart wasn't close enough, so they instructed him to do cough CPR, where you cough and you get yourself out of that rhythm, and it worked. He could have died, but the doctors, the cardiac doctors at Hennepin are crazy. They're so good. And it's just so upsetting to know that people are leaving because of this perpetual state that the legislators putting us in. They did this last year. I was there the last night, and they refused to go to a vote. They filibustered. They talked about their cabins and what they were going to eat for dinner, and the Republicans did not want their name on there. And we need more than that, and we need more than $150 million to just patch us a year. We need to get substantial money, make substantial changes and cuts, but Hennepin cannot die. It cannat die.
Thank you. Over to you.
So, MJ Lansana, I'm with the Council for Minnesotans of African Heritage, and I'm the Community Engagement Director. I do have our Executive Director, Allina Health. She's right there. We came to support our community. Kit Ellison, when I was my first year in college as MCTC, we invited you there. You was a little thinner. You just studying your politics. You know, we are proud of you in our community, and you are an inspiration to us. Most of the folks who are uninsured, underinsured are community of color. And this hospital serves us a lot. You know, I'm here for my community, and you are part of that community. You are here, this is the first step, put this into action to make sure that we can get the things that we need to be done. You hear from the community folks here. This is enough to get things done. Thank you.
Thank you very much. Welcome, and please introduce yourself.
Sorry?
I said, welcome, and please introduce yourself.
Thank you. Ann Jones. I'm a retired registered nurse. I've spent 35 years at the University of Minnesota Hospitals and proud member of Minnesota Nurses Association, working really hard with Healthcare for All Minnesota to fix how we pay for healthcare big picture. Once we stabilize and preserve this important safety net hospital, how about we think about a system that would keep us from getting into this kind of a crisis in the future? So I spent a lot of time talking to the public about the cost of our system, the underlying cost of our system. 34% of the money we spend on total health spending goes to the administrative side of a multi-payer system. I've been telling people that the billing department of hospitals and clinics is about 20 to 25% of the operating budget. Well, I looked it up today, and here AI is telling me that it's something like 40% of total hospital expenses include billing, coding, and denials management is the percent of the operating budget spent on just trying to get paid, which, as we know, in a safety net hospital is difficult anyway. There are reasons we're in this kind of trouble, is that we're spending money that doesn't need to be spent, that is not going to actual patient care. So how about we craft a system where we fund our hospitals and healthcare and public health with public dollars, maybe we all contribute something, and we have a system that serves patients, families, communities, and the people who take care of them.
Thank you. Thank you. I'd like to invite Dr. Greg Bielman, who's the CEO of the University of Minnesota Physicians, to speak.
Good evening, everybody.
I'm sorry, Dr. Bielman, before you get started, when heroes come among you, you don't always recognize them, but I'm telling you, Dr. Bielman has done such an amazing work for this state. Doc, thank you for everything you do. Thank you for training all the doctors you've trained, and thank you for being the tremendous leader that you are. Give him a hand, everybody.
How do I follow that? My name is Greg Bielman. I'm a general surgeon at the University of Minnesota. I've been there for 30 years and have the pleasure currently of serving as CEO of our practice plan, University of Minnesota Physicians, which represents 1,500 doctors and about 600 advanced practice providers. I've had the pleasure over my career of interacting with physicians and providers at Hennepin County. I want to thank them for their loyal and dedicated service to our patients every day. Thank you, folks. At the university, we share many things with our colleagues at Hennepin County. Most visible are our commitment to caring for Minnesotans, training the next generation of Minnesota's doctors, and helping bring research and care to patients across our state. My colleagues at Hennepin County serve an important role for the county and Minnesota, especially for those patients who are most in need but have limited means of affording the care that they need. Hennepin County is a major clinical training site, and we really haven't touched on that much this evening. That care and training happens both in partnership with the University of Minnesota and as its own hospital system. It supports the education of nearly 1/3 of Minnesota's future physicians, is home to 22 medical residency and fellowship programs, including Minnesota's largest emergency medicine program and family medicine programs. All told, if Hennepin County were to close, 230 current medical residents and fellows, including those in psychiatry, surgery, cardiology, and others, would be left unable to complete their training at Hennepin County. Many would need to leave Minnesota, meaning the investment of our state in those people's training and their future in our state would leave as well. With its many unique features, trauma care, hyperbaric medicine, and advanced training, among any others, it would be an incredible loss for Minnesota if Hennepin County were to close. Hennepin County needs long-term support from the state because of its critical service to the entire state through both patient care and education. Thank you for the chance to comment tonight.
Thank you, Dr. Bielman. And Doctor, I just want to make sure everyone who wants to speak for the first time
I have a totally different type of question.
Okay,
So
that's fine. I know that there are a number of physicians here and other staff from Hennepin County, and we want to hear from you this evening as well. So I'd invite any of you, including my neighbor, Dr. Tyler Winkleman, to speak, okay? But please, anyone else who'd like to take the floor. We're very pleased we have another one of the leaders of the University of Minnesota Medical School will be coming here to speak in just a moment. So others who'd like to, anyone else want to take the floor for the first time? Okay. This is my next door neighbor, Dr. Tyler Winkleman from Hennepin County.
Can't say no to that, can I? Mr. Attorney General, thank you for having this event. It is really uplifting to hear the support of the community, to be here with my colleagues who care so deeply about this organization. It is a tough time at Hennepin Healthcare right now. We have had many departures. And I am very hopeful that the legislature can come to support the health system. We need a durable plan that provides a medium-term solution for Hennepin Healthcare. Given the number of folks that we have lost, it's going to be a rebuilding time over the next couple of years, and that will be extremely difficult without a robust plan from the legislature this year. And I think you will also find, after we make it through this first pass, a remarkable amount of enthusiasm for this broader vision of healthcare from the folks at Hennepin Healthcare, who care so deeply about equity and care for everyone in our state. And then finally, I just want to say that one thing that hasn't gotten mentioned as much is the critical role that the organization plays in research. And many times, folks in our community are left out of important advancements in care, and we reach a population that we're able to bring cutting-edge research to that organization. It's a common place where we collaborate with the University of Minnesota as well. So I just want to mention that as another important piece of what we offer to the community. Thank you.
Thank you, Tyler. Please.
So my question is a pragmatic one. All of us here, I think, support Hennepin's survival and the urgency. We're dealing with a split legislature at a very short timeline. How can we be most effective and with whom to make sure that satisfactory legislation gets across the border? Because I sat with the Manufactured Homes Coalition for 8 damned hours listening to debate. Who do we influence to circumvent and get people to say this has to be done across the aisle now?
So that's a good question. Do we have a second for me to address that? Yes. So look, folks, I do want to make a call to action. I do want to make a call to action. It's great to be with each other tonight, but there's a few things that we can do, and so you're spot on to ask that. Number one, the people at this hospital, at this church and others have been doing vigils at Hennepin County Medical Center, and that has drawn attention to this crisis, and that has been extremely helpful. I don't know if you're still doing it, but they tell me that the prayers of the righteous availeth much. Is that in the book somewhere? Yeah. So that, for sure, vigils, prayers, things like that. Contacting your legislature. Believe me when I tell you, I used to be a state legislator for 4 years, and I was in Congress for 12. If any legislator, state or federal, gets a note on the same topic 3-4 times, that goes up on their list of priorities. Understand that from a legislative standpoint, all these things are important. Nothing doesn't matter. Everything matters. But some things got to be made to matter more than others, and that can be achieved by you making a bunch of calls to whoever represents you and to leadership. If you're any Republicans here tonight, that's a good thing. We need you to call your leadership if that's the party you identify with. If you live in a district and your legislator is of the Republican Party, we need them to help out. I'm not picking on them. Bless them. I'm looking for you to help us draw out the best in them. Their constituents need Hennepin County Medical Center too. So we need to call them. This is a priority. We're going to overcome the partisan back and forth, if only this time, right? We also, so letters, emails, calls. Now, the other one I want to mention is visits. Going to the state legislature. Between now and Monday night, if you have an hour or two, go down there. You can give a note to the person, to the security folks who work at the front entrance of the House and the Senate. Say, I want to talk to my legislator, and then they'll come out and you say, I'm here. I know you heard it 20 times. You're about to hear it 21. This is important, and you need to deal with it. But then also tell them, this is not a Band-Aid thing. A Band-Aid solution will not stop the personnel bleed and poaching. You follow what I'm saying? We need something that's going to give a medical professional enough hope to feel that we're serious, not just trying to Band-Aid a problem, but trying to fix a problem. So a meaningful solution, real money on the table, right? And then personal story. Trust me when I tell you, y'all heard Bill George talk about the 93-year-old woman that he knows. And he was right to tell his own personal story. So you figure out your Hennepin County Medical Center story and you tell it, because at the end of the day, the heart knows the heart, and you need to appeal to people, not just intellectually, but also emotionally. You understand? And then make your pitch around various things. Of course, they give great care. They also do great research. They also do great training. And so make your pitch multivariate, and then come in there as a whole community. I'm so proud that this young lady came and spoke in her mother tongue of Spanish. We need that too. We need people to understand. This is those of us who speak English, those of us who speak Spanish, Somali, Hmong, whatever. We need the whole human family right here. We need everybody, and so come in your beautiful diversity. But definitely have that contact. If you are a social media person, do a social media post about this event. Take a picture of the crowd gathered and say, I was at the church tonight talking about Hennepin County Medical Center, and I heard some moving, important stories. And tell them your social media account can actually do some meaningful good now. by lifting up this issue, right? You can even turn that video around and speak directly to the camera. I spent my evening at the Lutheran Church on campus, and let me tell you, it was well worth it. I heard some compelling, moving stories about what we need to do to save our hospital. Also, lift people's sights beyond the immediate emergency. Say, we're going to fix this problem, but we need to have permanent, serious healthcare solutions, not just patching old problems. So these are, but communicate. The first thing you need to do is communicate. The second thing is communicate. And the third thing is, right, this is not the time for being quiet, and this is the time for lifting up your voices and mobilizing the people around this issue. I'll tell you, I don't think the governor would mind if I told you what he told me, that this is his top priority at the legislature. He said it to me directly, and he's working hard at the legislature right now. That's why Jan Malcolm is here, because this is such a priority for the administration. This is why our union leadership is here. This is why Dr. Beelman is here. Dr. Beelman, how many surgeries have you done in your life? A lot. We're talking about a lot, a whole lot, but he's here tonight because the importance of this issue. So how about that? Is that enough things to do? Does anybody here tonight think of some things to do that I haven't recommended? Are there some things that you think we should do that I haven't mentioned? Because our only true limitation is our imagination. If we can think of more great things to do, we should do it. Let's brainstorm some. What do you got?
My name is Sandra Crump, and I did not come here with a plan to speak. I am a retired nurse. I worked in ICU. I've actually retired at Hennepin County. So when I found out about this from my legislators, I wrote a little note to them. So since I don't have anything prepared, I will kind of read what I wrote to them. I said, Hennepin County is undoubtedly an incredible asset to our community, our county, and our state. And in fact, we get people from all over the world that come here, and they're treated. I have worked there as a nurse, and it would be my personal choice over other local hospitals. It must be saved. So I have that as my premise. However, I hope this discussion will address what can be done about why Hennepin County is failing and who will be held accountable. And I thank you for taking this issue on, but I haven't heard that. I think a lot of things have happened over the last 20 years. They went from Hennepin County Medical Center to Hennepin Health Care. How did that contribute? You started the conversation off by saying this is through no fault of their own. I don't know that to be true. And if it is true, I'd like to see some documentation or some data regarding that. It seems that uncompensated care is considered a major issue. And so I'd like to say exactly what is the reason for uncompensated care. Can you enumerate that? Because we just say uncompensated care, and I don't know what that means in terms of a policy, a conceptual policy. And what can be done to rectify uncompensated care? Is it going to change, or is it going to always be like this? Do we continue, we need to, we can come up with a 1% tax or whatever. Is that enough to get us through? So what can we do to rectify that? And then why is so much burden of the financing of this being placed on Hennepin County? That's something that really bothers me. The tax, I understand that the tax, somebody mentioned the tax was about the ballpark and all of that. My understanding is that the ballpark tax was a 0.15% tax, and that this was added on to that because introducing a new tax would be a hard sell. That's my understanding. So if that's not correct, could you correct that for me? And is that a sustainable plan for the Hennepin County taxpayers to try and fix it? And what can be done about the federal monies that are out there? That, just to be able to snatch federal monies is my understanding. I don't know how that works. And for the uncompensated, it's uncompensated. Is it part of that because that money has been snatched back? And then one last question I have. Is Hennepin County still paying $66 million every 2 weeks for payroll for Hennepin County, or is that true?
Thank you very much.
I was just going to say this. There are a lot of solutions being contemplated, and the ones I've heard, and again, this thing is fluid, have been a statewide contribution, not only Hennepin. So for those of you concerned only that Hennepin is going to foot the bill for everyone, most of the proposals I've heard are going to be a statewide effort. But again, this thing is still being debated.
Thank you. Over to you.
My name is Ngwane Young, and for many people in my communities, it's already difficult to find doctors in healthcare systems that truly listen to us and understand our experience. So when patients finally build the trust and learn how to advocate for themselves within the healthcare system, that continuity of care becomes critical. If HCMC weakens or closes services, the entire process of self-adequacy starts over. Families lose trusted providers, care becomes fragmented, and patients already facing barriers are forced to navigate unfamiliar systems again from the beginning. Our healthcare ecosystem is already stretched by funding cuts and workforce shortages, as well as legislative pressures on budgets to providers. Hennepin Healthcare is more than a hospital system. It is a lifeline for underserved communities, and if it fractures, these communities will carry the burden first and the hardest. So I just want to stress that to everyone here and just say thank you again.
Thank you so much. Welcome. Please introduce yourself.
Hello, my name is Marita Bujo, and I came this evening mostly because I believe that this is a crucial issue for all of us. And when I hear tonight people talking about the ecosystem of healthcare, which is for Minnesota, but I think we're hearing across the nation a crisis in lack of access, in lack of capacity to train medical professionals, and lack of investment to make that happen. I'm wondering if we need to have a conversation about where our federal money is for investing and sustaining in something that is crucial for all of our communities. We're hearing that Minnesota is trying to do its best to shore up this problem right now, but we all know that long-term, the way that anything does well in this country is that we actually have our nation's federal dollars behind it. That's how we need to sustain this. So could we take a check on our expectations of Congress? Right now is a huge moment of opportunity as things are being torn apart to say, here's what we really want from you. Here are our expectations of you to do right by our communities. And certainly healthcare and all of the related cares that go with it are crucial for our communities. We know this. It's not some mystery. So could we take an expectation account of our Congress and say, we expect more right now for our communities?
Thank you. And welcome, and please introduce yourself.
Yes, thank you for hosting this event. My name is Ryan Jelinek. I'm an internal medicine physician, and I'm our Chief Health Information Officer at Hennepin Healthcare. My ask of you both and this audience is, let's not forget about the media's role in this. You mentioned social media.
Yeah.
There's classical media as well. We all know that once something's over, it just fades away, and we're on to the next thing. One of the things that we are struggling with and will struggle with, and Dr. Winkleman mentioned, our colleagues are leaving. right? We have physicians that are leaving. We have APPs that are leaving, nursing staff, others. It takes time to hire them back. If you're looking for a job right now, you're probably not going to go look at Hennepin Healthcare. The media attention has been, this is an organization that is on the risk of closure. I think we're all confident we're not going to close. We will find a way to persist. We will find a way to grow.
That's right.
But the concern is the media will move on. And the attention, if someone Googles Hennepin Healthcare, there's not going to be an article that says, hooray, we're going to be okay. And so it's going to be very challenging for us to replace our colleagues that have left. And so we need help keeping the attention of the media on this organization, how it grows, how it prospers, and how we're ready to bring qualified professionals back into our doors, because that is going to be a challenge. That is going to take probably many years. It takes 6 to 12 months to hire back a physician and cost the organization somewhere between $500,000 to $1 million. When you think about recruiting and credentialing, it's an endeavor, and it needs to remain the focus of the media attention. It can't just fade away.
Thanks, Doc. I think that's very wise.
Thank you. I'd like to invite Dr. Susan Cullican from the University of Minnesota Medical School to speak.
Good evening. Thank you, Attorney General Ellison and Ms. Quam, and especially the congregation of the United Lutheran Church of Hope for convening this forum to support Hennepin Health. I'm Susan Cullican. I'm a pediatric ophthalmologist and the Senior Associate Dean for Graduate Medical Education at the University of Minnesota. I can't emphasize enough how critical our partnership with Hennepin Health is for educating our students, our residents, and our fellows. Annually, approximately 870 students, medical residents, and fellows that are enrolled in University of Minnesota programs receive some of their training at Hennepin Health. With approximately 70% of our learners remaining in the state to practice, that constitutes 600 doctors a year who trained at Hennepin that we expect to stay within the state to care for Minnesotans. In graduate medical education alone, residents and fellows, last year we had 555 residents and fellows have required rotations from University of Minnesota programs at Hennepin Health. Hennepin Health provides unique experiences for our trainees that are not replicated at our affiliate sites. Without Hennepin, our programs would be forced to make very difficult choices. Either find alternate sites, likely outside of the metro and possibly out of the state, to meet accreditation requirements, or close the program for lack of educational experiences. In particular, I'm concerned about our neurosurgery program, whose experiences at Hennepin Health have been excellent. It's not a simple task to find excellent neurosurgeons at a level 1 trauma center who are clinically and educationally skilled and who have the capacity and the desire to add additional learners. This scenario is true for any of the 41 University of Minnesota graduate medical education programs, the dental residency, and the 300 medical students who care for patients and learn clinical skills at Hennepin Health. In partnership with Hennepin Health, the University of Minnesota programs are not just training doctors for Hennepin County, but doctors for the entire state of Minnesota. I implore you to consider the impact across the state of Minnesota if Hennepin Health should cease to exist. Thank you.
Thank you, Doc.
Thank you, Dr. Culligan. I want to invite anyone else from the community to speak for the first time, or if anyone else who's spoken before would like to speak again.
Hello, my name is Patrice Kelch, and although I'm retired now, I used to work for the Minnesota AIDS Project for 17 years, and I worked in client services. And I helped clients sometimes go to their first medical appointment, went to the appointment with them, and I could always count that when clients went to Clinic 42, Hennepin County, they were always treated respectfully. This is particularly important for our trans clients who often went and felt that they were disrespected. And I have to say that the care that people got at Clinic 42, I was always confident. And some of the doctors there were great researchers, great educators, came talk to the staff. So I just want to acknowledge how compassionate and important they were. But I also want to say, and I know this isn't something that's going to help us right now, But in our K-shaped economy, why do we not have a luxury tax on luxury cars, furs, jewelry, luxury second homes, and boxes at all of the stadia that we are paying for? They don't have, there's no tax on going and using those elaborate boxes at the stadiums. I really want us to get behind really having those who are able to pay, the most able to pay, who are doing fantastically well right now, fantastically well. We need to get them to pay a wealth tax. Thank you very much.
I agree.
Thank you. Welcome. Welcome, and please introduce yourself.
Hi, my name is Lori Adams, and I also did not come here with the intention of speaking. However, after hearing all of you, I'm certainly inspired enough to speak. First, I'd like to thank the many members of the medical community who are here because you're responsible for saving my life, and I appreciate you. A couple of years ago, I had a surgery, not by a doctor at Hennepin Medical at HCMC. And during that surgery, it was for something minor, but he nicked my spine during a surgery. 3 months later, I could no longer walk again at all. I had an ambulance come and pick me up because I knew I just couldn't do it anymore. And they asked me, where do you want to go? And I said, HCMC. There is a wonderful neurosurgeon there who operated, and when I say saved my life, I mean literally saved my life. I spent 38 days between the hospital there and then inpatient physical therapy at NAP over Christmas, over New Year's, etc., but always getting better each and every day that I was there. It has not only become my home for my care, but has extended beyond the initial care that I received there. It has been my home for occupational therapy, for physical therapy. The time I came out of surgery, I never knew if I'd be able to walk again at all. I'm not doing it well, but I'm walking today, all right? Thank you. It came to the point where I even transferred my primary care to Hennepin Health. Now the tough part is my primary care provider recently left. And so I am now once again looking for primary care. I don't want to leave Hennepin Health because it has become my home. But my reality is that the amount of care that I'm now seeing is beginning to decrease, and that's obviously not something that I want. So I'm here to tell my story. You mentioned going to the legislator. I had the opportunity last week to actually go and do that.
Thank you.
Speak one-on-one with legislators, just to say, even if you already support it, at least hear my story, and you can use my story to talk to other people in order to convince them. So again, I just wanted to take the opportunity to thank everyone here and let you know my story.
Thank you very much.
Thank you so much. Thank you very much. I'm going to ask Jan Malcolm to stand. Jan, when you were out of the room, we gave you a shout out. Let's give a round of applause to Jan Malcolm.
Thank you, Jan.
Yeah.
I wasn't initially going to speak, but I thought I would highlight the fact that Hennepin County has one of the best traumatic brain injury programs in I think, of the country, I'm going to say, but for sure in Minnesota. I'm a member here at University Lutheran Church of Hope and Bean, and I was out for a run about 10 years ago and slammed my head into a car window and ended up going to Abbott. It was the closest hospital to go to, and they did all the testing and said that you need to go to Hennepin County, and ended up getting 1.5 years of therapies from the services there, and I am forever grateful.
Thank you.
Thank you so much. Welcome. Please introduce yourself.
My name is Sean Kennedy. I'm a nurse at HCMC, almost 27 years, most of it at the jail, the last 2 years inpatient psychiatry. And in the community, I saw someone that was with the ACT team, and they help persons with mental illness stay strong in their community, in their neighborhoods. And she told me that Hennepin inpatient psychiatry prepares their patients so well for the discharge so they can live out in the community. And so I'm glad to be with the coworkers I have and glad to be with my union. Thank you for being here today.
Thank you.
Thank you. Attorney General, you want to close us out?
Well, everybody, please join me one more time in celebrating with an applause the University Lutheran Church of Hope, everybody. A wonderful body of believers who invited us in today. Let's thank our Master of Ceremonies, Lois Quam, and all of you, including the nurses, the doctors, the medical executives who came out to really help folks understand, all of you who shared your very precious testimony. I want to say thank you to my son, who is a nurse at Hennepin County Medical Center. He, out of high school, he went straight to the Army. He was a combat medic and then became a nurse. And he said to me many months ago, hey son, hey dad, what are y'all doing about Hennepin County Medical Center, my job? And he made it real clear. So Elijah, would I embarrass you if I asked you to just stand up and wave at everybody? Yeah. Thanks, Elijah. And thank you to everybody who came down today. My wife's here. She's a doctor, trained in Columbia. Good to see you, my love. Thank you for being here. And to every one of you, let's call, let's communicate, let's talk about the urgency of this moment, and not just have a Band-Aid, but a real good deal to give us a real future. And then let's talk about real healthcare reform in America and in Minnesota. All right. Have a good night, everybody. Thank you very much.